No, that's okay. So I don't think I have to really, I wasn't sure what if the audience was gonna be all that well familiar with climate change, but so this will be a refresher for many of you that when I started giving this talk with, on climate change and health, we had just crossed the 400 part per million threshold. And the most recent that I could find is now 427 as our latest CO2 reading. So continuing that upward trajectory, which of course leads to first order impacts on the climate and meteorological sort of environment, then second order impacts on our biophysical systems, the forests, the oceans, the grasslands. We start getting at the health effects when we are into the third order effects. So those knock-on effects that are related to heat, that are related to infectious disease transmission, food security, water security, et cetera. And then finally, we have, a growing sort of understanding of the social and political impacts of climate change, be it driving migration from rural to urban areas or driving migration more broadly, leading to, food insecurity, leading to civil unrest, all of these kinds of sort of further sort of cascading events that occur. I'm going to really focus, of course, today on the third order sort of events, which are sort of more related to climate change. Probably most of you have seen this slide, the CDC sort of what I call wheel of doom, which indicates sort of all of those events that the rising sea level, increased CO2, rising temperatures, and more extreme weather can lead to in the realm of health. And so we have a myriad of health outcomes that get impacted from more direct impacts like heat and heat deaths to something that's a little bit more distal. So cardiovascular disease deaths or changes in triggers for asthma and allergens. All of these things are sort of at different sort of levels of complexity related to climate change. And I think that what we don't know is sort of how they all interlink. And I think there's a lot of interlinkages that we are not yet understanding. So when you think about sort of extreme heat as a big picture, extreme heat is something that is not just an issue with places like Arizona, which have always sort of had a hotter sort of environment. It's something that's sort of broadly across the globe. I think that they have demonstrated that there was a 26% increase in extreme heat days that have been attributed to climate change. So 26 extra days, sorry, not percent, but 26 extra days in 2023 that were attributed to extreme heat. So that's a lot. And then as part of the NCA, one of the things that I was working on as an author on the climate change and health chapter was really trying to understand sort of the inequitable distribution. And so I think this is also sort of preaching to the choir, but knowing that sort of this health inequity is hugely sort of in line with other sort of health inequities and disparities, which are, historically redlined communities and low wealth communities are often hotter than other neighborhoods. We'll talk a little bit about green space and how green space can mitigate that, although that is differentially distributed across urban environments. Access to cooling centers is more limited in many areas than others. The energy costs, so some of my colleagues have done surveys in communities in Phoenix that demonstrate that even if you have a nice central AC, you may not have the resources to actually operate it. So just having the infrastructure in place does not actually mean that you will remain cool. And then of course, there are other populations that are more vulnerable to extreme heat and have less access to healthcare. Individuals who are socially isolated, we find that most of our heat deaths are often in the elderly who are isolated in their homes. And then of course, the compounding risks. So there's also a chapter in NCA that I led that's looking at COVID-19 and climate change interactions. And one of the things was that with COVID-19, they closed a lot of the cooling centers. And so there was no place to really go, or people wouldn't go as regularly because they were afraid of being around other individuals and exposing themselves to COVID. So this is sort of that double burden that occurs highest in sort of disadvantaged populations. This is zooming in a little bit more closely into the region in which I work. You can see that we have sort of record-breaking temperatures. In 2023, we had 117 in Phoenix, 112 in Yuma. These are records that are, breaking previous records of 108 in 1992. I mean, that is a huge difference. We have, multi-days where you have sort of days at a time where you have over 100 degrees or just becoming longer and longer. And yeah, it is really extreme. And when you're living there, it's sort of reverse of someplace like here where you're indoors in the winter. There, if you can be, you're indoors in the summer. But again, that really depends upon your cooling infrastructure that you have and your ability to keep your place cool. So 2023 and 24 were the hottest ever recorded in Arizona. Tucson and Phoenix are among the top 5 fastest warming cities in the nation. So we are sort of ground zero for extreme heat. And Arizona is the 3rd fastest warming state in the nation. So in 2023, Phoenix had 73 days with temperatures over 100 and broke a record with 31 consecutive days over 110 degrees. It's really hot. And you can see some of the public messaging that is out there. So a lot of heat deaths in outdoor recreational areas are for people who are coming from outside that aren't acclimated, that sort of come to this environment, are totally unprepared. I mean, pretty much I would say about 90% of people travel everywhere with a water bottle in Arizona. You don't see people without those. But when you have guests coming in, they might take those little, a little plastic water bottle on a 3-mile hike up a mountain, and then that is just not enough. So messaging can be beneficial. The heat-related emergency department visits are also quite high. This is hundreds of people on a week that are going in for heat-related illnesses across the state. And this is 2023. 2024, the peak is a little lower, but you can see that the pattern is much hotter. So it starts getting hotter sooner and didn't cool down as rapidly in 2024. We just had sort of like this long, hot sort of plateau of really hot days. And so as part of sort of this mission to try to address extreme heat, but other sort of effects, we have developed this P20 that we were fortunate enough to get funded, and praying that it will stay funded, to address extreme heat and other related issues, called the Southwest Center on Resilience for Climate Change and Health, SCORCH. So our mission at SCORCH is to improve health equity in arid lands, but really focusing on Arizona at this point, across the lifespan by enhancing existing community partnerships and supporting adaptation efforts by Indigenous, Latinx, low-resource urban and rural communities in the southwestern United States and globally. So I'm going to tell you a little bit about the structure, but first, this is our team, which is comprised of sort of on the left here, you can see these are my fellow MPIs, Mona Aurora and Joe Hoover, who are both assistant professors. And she has her degree in geography and he has his in environmental science. So we have a little bit of a diversity in discipline and the leadership level. And then we have sort of a really nice team of people in the College of Architecture and Planning, in environmental epi, biostatistics, epidemiology, engineering, etc. So what do we do in SCORCH? We're really trying to lean into this arid lands focus because of where we are. We think it's important to really focus in on what we know, which is arid lands. And so the global extent of arid lands is actually quite significant. About 47% of people are living in arid lands right now. That's a huge proportion of the population. And I think sort of that arid lands context doesn't get highlighted enough as an important factor in determining health. And so U of A has an arid lands research and education focus and has for many years. And so the structure of our P20 is similar probably to the P20 here. We have our administrative core, which I lead. I try to sneak some research in there. We're trying to do some synthesis and evidence gathering for some for a sort of scoping review on sort of arid lands and climate change. We have the community engagement core, which is led by Mona. We have the integrated data visualization core led by Joe, and then we have the 2 projects similar to others where we have Melissa Furlong, who's focused really on reproductive health, and then trade-offs in green space design for health with Dr. Shijie Li. All right, and so our 3 sort of focus areas for research, which are mostly supported by the projects, but you know, we have a more expanded sort of area and aim, which is to really understand more of these impacts of extreme weather events on sort of the indirect long-term health outcomes. So I think a lot of times when people are doing disaster research or research associated with extreme weather, they're looking at sort of that acute phase. So what's happening in that month, days after an event. And we're really interested in sort of what are the longer term consequences? What is the consequence of, so in project 2, looking at exposure to heat waves during pregnancy and neurodevelopment of the child. So looking specifically, Melissa is looking right now at ADHD, development after in utero exposure to heat. We have a focus on the development and implementation of forecasting and early warning systems. So this is an initiative that's in collaboration with the National Weather Service, the Department of Health, and the We Health Corporation. So this is a mobile platform dissemination of actionable messaging. I've been working on this project sort of since COVID, when it used to be COVID Watch, and it was the Google Apple exposure notification. I don't know how many of you remember this, where if your phone was in close proximity to somebody who had COVID, you could notify them. Be pretty handy to still have that for the measles outbreaks, but Google and Apple in their infinite wisdom decided to do away with that. So we have repurposed this platform to be a platform that at the county or even small jurisdictional level, somebody can have their own sort of channel and craft and hone their own messages. But we're also using data from the National Weather Service, from the CDC, from the FDA on outbreak. It's kind of an all hazards preparedness platform. And right now it's much more about like what's happening currently that people need to know about, and then making use of sort of the AI and large language models with a human in the loop to ensure translation that is seamless into both video messaging as well as written messaging about the event. And I just saw today a headline that said NOAA is no longer supporting translation services of their messaging to the public. So I'm hoping that a platform like this will make that kind of information more accessible to people if it gets used. So there's that. Eventually, what I'd really love to do is to put more of that forecasting component in there to give people more of an early warning system in addition to the what's happening now. The third sort of pillar of our sort of research program is adapting the outdoor environment to enhance resilience in communities. So that's the project I'm going to talk about a little bit today. And that's using a community engaged framework to understand trade-offs and design choices on health impacts. And so as many of you are aware, when you have a lot of shade in an environment, that can be a nice resilient strategy for heat. It can mitigate the urban heat island effect. It can provide sort of cooling areas for a community and outdoor spaces. And this is just sort of exemplifying in terms of surface temperature. It's not air temperature, but these cameras that show just how big a difference surface temperature can be in shaded versus unshaded environments. So we're all aware that shade can really create a nicer environment for us to be when we have sort of a heat event. But green space is associated with many different health outcomes, both directly and indirectly in terms of recreation, mental health and well-being, heat reduction in cooler spaces. And then sort of on the other side, you have, it can also be associated with negative health, right? So if you have green space, you can have increased allergens and you can have higher vector abundance, which I'll talk about in just a little bit, and exacerbation of asthma. So that's sort of the premise that we're working on, is that when you have a community that is trying to plan green space, you really need to consider what those potential trade-offs are, what's acceptable to a community, what's their priorities in that sort of design phase. Because we are an arid environment, most of our green spaces are cultivated in a way. You have to actually plant things and grow things there. It's unlike sort of many sort of urban environments where if you leave it, it's gonna spring up with green things. We don't really have that, so it has to be relatively intentional. And this is something in terms of heat adaptation that is sort of being sort of discussed more broadly. So looking at the CDP ICLE tracker questionnaire data, what we found is that among 249 heat adaptation action plans at the city level, and mostly city level, some towns, some counties, some regions, a lot of them had green space as an action that they were planning on taking in order to adapt to increasing heat. So trying to figure out a little bit more about sort of what's going on sort of across the nation, and then also zooming in to understand what green space is doing for heat in Arizona. And so we're making good use of the vital records data that we have here. So using ICD-10 codes for heat-related deaths, the exposure to excessive or unnatural heat, P67, which is the effects of heat and light as an underlying cause of death or contributing factor. And then we identified controls that were matched on year of death, gender, age difference, and death dates within a week, and identified controls at a 3-to-1 ratio. So in joining that data to satellite imagery, we were able to use the NAIP imagery, which is 1 meter resolution. And that's available in multiple years. And so it's mostly the leaves on season. So looking at green spaces is better for using those seasonal data. And then classifying the imagery based upon NDVI that's mostly been used in the literature. And these analyses were conducted by Drs. Wien Chu and Washeen Wang, who are both at Utah State. And so they were classifying sort of at this very, very, very fine scale what the green space is in these environments. And they classified it based upon multiple sort of configurations of green space. So it was percentage of green space, the number of green spaces, so how many sort of dots of green are there, the mean size of the green space, so is it a large park environment, is it a tiny backyard, like what's in this neighborhood? The area weighted mean shape index, so trying to figure out, is it like one contiguous area? Is it sort of a funky sort of shape with lots of boundaries? The connectivity among different green spaces, which for my purposes is really important as a vector-borne and infectious disease epi, because you have, paths for zoonotic hosts, et cetera. And then the mean Euclidean nearest neighbor distance. So how spread out are they, or how close together are they? So it took that imagery classification and then did conditional logistic regression modeling, 3 different models looking at sort of the basic adjustment, which is controlling for your death, sex, age, and death rate. So just doing sort of that clean matched design. Then adding in individual level demographic variables to model 2, and then neighborhood level sociodemographic variables to the next one. So all of this is with the sort of long-term goal to develop a model and framework that can take a plan, a green space plan, and sort of input it into this model, and then on the other side, see what are the projected health impacts of this plan. And so it's a lofty goal, it's a long-term goal. First, you have to understand what those associations are before you can start developing that sort of tool aspect. But what she found across all models were that when you had green space So note, these are very, very tiny differences, but most of these are 1% increase. So 1% increase of green space is like a 2% reduction in heat-related mortality. And that's sort of a, the long-term outcome. And these are after adjusting in model 3, after adjusting for sociodemographic variables. And so you can see it's very consistent. The only one that doesn't really seem to have a strong association is the mean size. But these are just all sort of very drafty initial analyses. But I think what's important to see here is that they each have sort of an independent and significant or impact on decreasing heat mortality. So when you have higher number of green spaces, higher percentage is green space. When the shape complexity is greater, which means it's a little bit more of that spidery thing than one large park, and the connectedness and the closeness, all of those things actually reduce heat mortality or are associated with a reduction in heat mortality, even though it's small. So those kinds of small benefits, when accumulated over a long period of time, could actually start to make a difference. Now I'll sort of switch gears and talk about the flip side. So these are all of the significant benefits of green space, having more green areas that are more connected, et cetera. So some of my prior work, which is where I sort of got interested in this landscape analysis, was related to Aedes aegypti. So Aedes aegypti is also called the yellow fever mosquito. I don't know how many of you know a lot about it, but since you're working in Latin America, you probably know, or maybe even intimately familiar with dengue and Zika and chikungunya. The Aedes aegypti mosquito is highly adaptable. It's a human commensal. It lives in and among people. It's a day biter, so bed nets are less useful, though I do think that there's a way that you could use it to block transmission back to the mosquito. And obviously they are able to transmit yellow fever, dengue, chikungunya, Zika, and Mayoral-virus. So what is it about mosquitoes that is associated with weather and with climate? Well, I think one of the first things to know, and I don't know if we can, I don't know if the volume will work. I may just have to talk through the video. So this is a video that was made in my colleague's lab, which shows the life cycle of a mosquito. And the reason that I like to show this is so that everybody has kind of an awareness of what's going on in the life cycle of a mosquito. So this is a female. She's feeding on my colleague's arm. He allowed her to sit there and feed. And you can see her abdomen is getting distended and turning red. She then lays her eggs in some sort of container source. So the way Aedes lay their eggs is if you have a water-filled container, she lays her eggs just above the water line on the side. And so they're just like dots on the side of the container. And this is a little larvae that is struggling to get out of the pupal case. This is the first instar larvae, and you can see here at the top, they have a siphon that gets oxygen and air, and you can see they have little beaters, and I don't know if you can see those, maybe not in this one, but once they move on to the next stage, you can see the fluttering here because they're filter feeding from organisms that are in the water. Then they turn into pupae, which a lot of people in the community will say, oh, I have tadpoles. They're not tadpoles, they're pupae. And so then this is accelerated 10 times faster, but then these adults sort of go on to the surface of the water and they emerge from their pupal case and break free over a little bit of time. And this takes a few hours, usually, for them to emerge from their pupal case. And she's out. And then they complete that cycle by another blood meal, right? So you have this cycle that's going on with these mosquitoes, and those are associated, because they're ectotherms, those are tightly linked to temperature. They're also linked to humidity and precipitation. As you can see, they have to be in an aquatic environment in order to get through their immature stages. But if we focus in on temperature, which is sort of one of the big things that's changing with climate change, we can see that when you have higher temperatures, it changes the metabolism. There's a faster metabolic rate in the mosquito. And so that changes different components of the transmission dynamics of the mosquito. But it is not just like a linear sort of distribution or a linear curve, right? It's not that every temperature increase is going to lead to sort of higher levels of transmission. It's much more nuanced and complex than that. So if you look at the development to adulthood, so if you have a cold environment, if it's under 20 degrees Celsius, it takes a really long time for that stage to go from the development to adulthood. So then once you reach 20 degrees though, you really get this threshold effect where now it's right around, a week or 2 weeks, and then it starts to decrease even more. So that's one that sort of like has a real threshold effect. When you get up to about 35, 40 degrees, you're kind of not really having, and honestly, most lab studies don't really go beyond 35 degrees. They sort of stop a little earlier on. And then you have your EIP length, which is this short one. Where is it? Oh, yeah, I think it is this white one here. So yes, it is. So you have 30, well, it shouldn't be. I thought it started earlier. Okay, so we'll just say EIP is one that sort of very much decreases linearly. So that's the time. The extrinsic incubation period is, as I tell everybody, a mosquito can't land on me if I have dengue and then fly over to you and infect you. There's a time frame in which the mosquito has to develop, the virus has to be ingested into the gut, it has to develop, it has to migrate back to the salivary glands, and that can take anywhere between 4 to 10 days. That's very temperature dependent. So the warmer it is, the faster that EIP is, which would make you think warmer conditions, much more rapid generation times of the mosquito, of the virus, etc. We're going to have much higher transmission. But when you start to look at some of the other parameters, so the survival, that's the one that's sort of working against higher temperatures leading to more transmission all the time. So you can see that survival starts to decline around 22, 23 degrees. And some of our research shows, however, that this is all laboratory data. And so when you go into the field, those mosquitoes are just as clever as we are at finding green spaces to hide out in to survive when it's really hot. So you start to see this sort of decline in survival when you get super hot. They also don't feed as much. You can see this is the feeding behavior. The feeding behavior really declines when you have it really hot conditions. And so you kind of have like this push-pull where some things are pushing the transmission to be higher with higher temperatures, and some things are forcing it sort of lower. So there's kind of that medium sweet spot, if you will, where transmission is optimal. Okay, so there's also a lot of global changes besides climate change that are happening. Global change is not in isolation. Increasing urbanization, increasing habitat, increasing travel, increasing trade. Maybe. You don't know. We'll see. Pending new events. It used to be increasing trade, and in fact, the used tire trade is how Aedes albopictus was introduced to Texas, because those tires are really awesome, like environments. They're warm, they're black, they hold the heat, they hold the moisture, and that's how they can be introduced. So taking that information and really thinking about what we're doing in Arizona, this is our beautiful native desert environment. This is out, I think, in Sonora. Yeah, this looks like Sonora East. And so you can see the mountain range, the beautiful saguaro cactuses, our sunsets. I'm telling you, when I first moved to Arizona, I was like, oh my gosh, the sunset is so spectacular. And then after, 365 days of me saying, that sunset is so spectacular, I'm like, this is normal, because people they really are beautiful out there. And rainbows are like all the time. It rains, there are rainbows really frequently, and all of that really surprised me. But this is our beautiful environment. This is a lot of xeriscaping that happens in many communities. You can see they have native plants, they have some cacti here, a lot of sort of rock environments. And then you have what I call sort of more of like the greening and the tropicalization of, and you can see here, this is sort of native environment here. And then you can see these are agricultural areas, so extremely green. And then you have little spots and pockets of green inside inside the city of Maricopa. So this is, or sorry, not the city, the county of Maricopa, the city of Phoenix. So this is a satellite image of Phoenix, Arizona, which has a very large geographic extent and is growing every day. It is truly remarkable how many people want to move into this environment. But there are HOAs in Phoenix that require you to have a yard, require you to have grass, which is mind-boggling to me. Tucsonans, we don't do that. We encourage xeriscaping, but Phoenix has a lot of transplants from the Midwest, and they want their grass, they want their trees, they want the same plants that they grew in their garden in Wisconsin, in their backyard in Arizona. And so it creates a real sort of push-pull dynamic there. And so one of the things that we started looking at was, well, what does this sort of greening of the native environment do to mosquitoes? Aedes aegypti, as I said before, they're invasive species. Some people say, well, if you kill all the mosquitoes, aren't they food for other organisms? And if you get rid of them all, isn't it gonna, cause destruction to the ecosystem? And I'm like, they're invasive. So the native plants and animals were doing pretty well before they were introduced. And so one of the things that we take advantage of with our research here is that Maricopa County, which is where Phoenix is, has an incredible mosquito database. So they set 700 to 800 CO2 baited traps every week all year. This is probably one of the most extensive mosquito surveillance undertakings that I know of. If you know of one that's better than this, please let me know. They started during West Nile, and then they evolved to include Aedes aegypti as well. And so working with them, looking at sort of their Aedes aegypti female trap counts, and then looking at climate data more as a sort of control than really actually looking at the meteorological data as an explanatory factor. And so what we found was that rainfall was associated with increased counts of the Aedes aegypti females. So you can see a little bit of a 10% increase with the 5 millimeter increase in rainfall in the previous month. Temperature is really interesting. So we saw that shape in our data where you had, if it was less than 29 degrees Celsius. So remember that slide I showed before, where the abundance and the survival was really more around like 24, 25 degrees Celsius, but we didn't see a downturn in survival or abundance of mosquitoes until it was greater than 29 degrees Celsius. So I think that what that shows is that difference between a lab study and sort of field and what actually happens in the field is that there's a higher margin that they are sort of able to adapt to in warm weather. And it's also possible, which I'd love to look at, and I keep trying to convince my entomological collaborator that you really need to use those incubators and look at mosquitoes from Florida and other places and our Arizona mosquitoes to see how heat adapted they are. Because it is possible that we just have better heat adapted mosquitoes. So teasing out, is it their behavior or is it a genetic sort of adaptation that's occurred or evolution that's occurred? Still unknown. We also found that increased wealth and population density are associated with Aedes aegypti counts, inversely to what you might expect in our area and environment. Even after adjusting for green space, you actually had more Aedes aegypti in higher income areas than in lower income areas. I think there might have been some uncontrolled factors, I don't know, but I also think that because even though you control for some of the green space issues, we may have not fully controlled for that. Population density, not surprisingly, you have an increase. And then vacant homes, unlike West Nile virus, where vacant homes is strongly related with higher sort of West Nile in mosquitoes and birds, with a human-loving mosquito like Aedes, that actually is associated with a lower level. But what I really wanted to talk about today is this tree cover association that we found. So we found that as you have a 1% increase in trees, you have an IRR of 1.07. 1% increase. So, and then the percent bare earth, so the more sort of scorched earth approach you do have fewer mosquitoes, not surprisingly. I don't think any of us want to live in an environment like that. But what's very striking is this, which is the dose response with tree cover is pretty exceptionally clean. So what we did is we had a mosquito trap, and because Aedes aegypti don't fly very far, we had a 50-meter buffer around each trap, and then we quantified the green space using 1 meter resolution data, looked at grass, trees, bushes, etc. And this is the one that really popped in terms of being highly associated from that land cover perspective, where you have the lowest quartile of trees, that's the light green, and then you have, as you have increasing sort of percent cover in that buffered zone of trees and shade, you have a much higher increase in abundance of Aedes aegypti females. And the thing that strikes me is that it's not just that the peak is higher, but you also start to get a higher abundance earlier in the season, and the off season, it stays higher longer. So these areas where we're really greening the environment is also leading to potentially better habitat for these mosquitoes as well. And I may be the only one in the room that follows the dengue news in the United States, but California had multiple sort of outbreaks of locally acquired transmission this year. We actually had locally acquired transmission in 2023. Yeah, I think 2023. Don't quote me, I'm blanking on it. Because we had a huge outbreak in 2021 and sometimes better. But so we've had locally acquired transmission in Phoenix as well. And some of our studies have shown in the past that it is not just that. So I think there's also a surveillance issue. When you talk to physicians and clinicians and you ask them, have you seen anyone with febrile illness? They're like, yes. Did you test it for dengue? No, we don't have dengue here. So I think there may be some surveillance issues too that we need to address, and physician education to increase awareness, particularly in areas like this that have ample Aedes aegypti populations, have the potential for introduction through travel. We have a lot of return travelers who come back with dengue, that we should be a little bit more aware of that. So we thought, well, maybe this is just Maricopa County, who knows? And so working with partners in Mexico, my good friend and collaborator, Maricela Montalvo Corral, works with CIAD in Hermosillo, and we had a small grant to sort of look to see if there was something similar going on in Hermosillo. And her approach was a little bit different because they don't have the robust network of traps like Maricopa County does. And what she did was she identified areas that were sort of vegetated neighborhoods, so high vegetation neighborhoods based upon Landsat imagery, and then really low vegetation neighborhoods that also, were classified on Landsat imagery. And then she went and she purposely sampled in high vegetation and low vegetation environments over the course of 1 year, and identified that indeed the pattern was holding true there as well. So the blue bars are the weekly, the weekly trap counts. I don't know why it says 19 and 20 and then 26. So I guess these were 2 days. So she did 2-day trapping events every week. And so you can see that the blue bars are almost always lower than the red bars, which are the high vegetation. So high vegetation is in red, Blue is low vegetation. This is a small number of sort of track sites. So, you know, the confidence intervals and standard deviation is quite wide. But the pattern is still holding. And we're hoping at some point to be able to dig into this a little bit more deeply. We're very curious about the sort of kind of vegetation. So are there some vegetation sort of palettes that are tipping more towards vector abundance and others that are away? I'm assuming that, you know, plants that have flowers and sugar sources are going to be more associated with higher levels of abundance than those that don't have sugar sources. But hopefully we will dig into that. One of the things that she found really interesting in the course of her work was there's actually a prescribed vegetation palette that the government recommends that is low water use, native plants, etc. But when she went to the greenhouses in Hermosillo, that's not what's being sold. What's being sold are tropical plants, you know, the beautiful large flowers, etc. So she's like, huh, I know this is a little sort of out of touch with the recommendations. So we would really like to continue to do that. So you know, the adaptation plans in Phoenix really included planting a ton of trees. So they're part of the Million Tree Initiative. They were given $50 million shade program. And so really understanding the unintended consequences of these kinds of greening adaptations is critical. And I was hoping to be able to sort of follow this. Unfortunately, the program got canceled by the federal government. So there are no more tree planting programs. Maybe most of you knew this already, at least not from the mechanism that was funding Phoenix. So that will be something that is TBD. I think that we still have some things that are planned in Tucson and maybe local initiatives to try to build this up, but that is not unfortunately gonna happen. So the next steps in this research is to continue to develop the model, take that same model that she was using for looking at all of the configuration and different green space, and instead of just having shade cover like we had, which is kind of a blunt tool, delving into the composition of the green space, looking at that connectivity, looking at these other things, and trying to get a more sort of nuanced association between green space and composition and mosquito abundance. Then we're going to do some workshops with planners to co-develop the model for this tool. And then community engaged research, we're going to do some discrete choice experiments to try to understand what's important to the communities in terms of green space use, et cetera. And then we're just starting this summer a photo voice project with youth about, you know, how you use green space, what's important to you. So, so this work has been variably funded by different sources over the years, and we have a nice team. When I'm listing my collaborators that are not a part of Scorch 4, just to make sure that they all get acknowledged. And that is all I have.
Thank you. That was super interesting. I learned a lot of things. It's great. Questions, comments from here? Chuck, go ahead.
Yeah, so I like you to respond to tree cover versus mosquito density. But the next step in that would seem to me, how well is it documented that there's a dose-response relationship between mosquito density and a rate at which the vector-borne diseases themselves are contracted?
Yeah, that's an excellent question. That's something that I actually delved into in a different project because it's not straightforward.
Yep.
It is not straightforward at all. So there is a sort of, you know, I think Roberto Barrero really says that there's a minimum threshold in which you have, I think he says like 3 females per trap night or something like that. But I don't think it's as clean cut as that, because what we found in a study that we did in northern Mexico is that in an area where you have significant transmission, in Hermosillo, which has regular seasonal transmission, there's lower numbers of mosquito than where in Nogales, which is one of the border towns, where you have a lot of mosquitoes around. But no, really, very, very little local transmission. It's not infrastructure. The infrastructure in Nogales is definitely not as good as the infrastructure in Hermosillo. So we delved into the survival of the mosquito. So what looked like it was happening there is that in Nogales, even though you have a lot of mosquitoes around, none of them are the old ladies that are actually transmitting. So the age structure of the population was very different. I think with something like this, where you're greening an existing environment, I think that abundance could sort of shift transmission potential up. If you are, because the other factors like EIP, I actually was thinking about that the other day, is like, how much will shade cover actually increase the EIP? When you have, will it actually noticeably sort of lengthen the EIP in a shaded environment that's, you know, multiple degrees cooler than in, so again, you go back to that very complex diagram that has sort of, where's that sweet spot? But you're absolutely right. Higher mosquitoes does not always translate to higher transmission. Within an area, when you start to have your increased mosquito abundance, usually you have your transmission starting to come up after that's coming up. But yeah, it's not clean cut. You're right.
Good questions. Sorry.
Thank you. I'm wondering how you would kind of compare the magnitude of the public health risk or burden from, say, heat and then from these diseases in a place like Phoenix or
Yeah.
Tucson.
It's a great question, which is why I don't say in my talks, oh, we shouldn't plant trees, because I recognize that heat is probably a more imminent threat to our population than dengue at this point. Now, you know, could that change in the future? Maybe. Is it also something that the public might perceive as a barrier to use of green space? So it's, you know, if you have all of these sort of mental health, physical activity benefits of green space, but now you have biting mosquitoes, even if there's no disease risk, it's freaking annoying. People hate them, and they don't like ticks either. So we're doing tick work in New York. And so it is a deterrent to people using those green spaces, disease risk or not. And so that's something that I'll be really curious about, because, you know, a lot of people they move to Arizona from other places and they're like, I didn't think there would be mosquitoes here. Why are there mosquitoes here? And I'm like, well, it's mostly because of us. We are the bringers of mosquitoes. So, but it's, and, you know, I hope that we'll be able to kind of tease out some of that with our work in the community.
Is there any questions on Zoom, just in case? No. Jerry, go ahead.
Thank you for the wonderful talk. I wonder if there's any conversation about the potential increase in wildfire risk as a result of greening, given what happened in California a couple of months ago, and how that might fit into the risk balancing.
Yeah, absolutely. So when we first started having this conversation, we were kind of like, well, which trade-offs should we look at? Should we, you know, because there's a lot, right? There's also the increased allergens and pollen, and there's the increased fire risk, particularly if it's coupled with drought. And we know that in our area, there's also a water cost. We live in a desert. It's a massive amount of water if you're not using native trees to continue to water them and get them to grow. So I mean, there's a lot to consider, and we just picked the initial two because I know mosquitoes and they know heat. So we're like, okay, let's start here, and then we'll build in some of these other. And we'll probably, with our discrete choice experiments, we'll probably bring in some of these other factors. But you're right. I mean, I think, yeah, fire issues are there, and Mount Lemmon, which is very close proximity to Tucson, has had some wildfires in the past. Fortunately, they haven't had anything recently, and it doesn't usually come down to Tucson proper, but the smoke is a really big issue if there is one there too. And we have buffalo grass, which is a really big problem for wildfires. So it's an invasive grass species that dries out and become a real, it chokes off other native vegetation. And that's actually probably one of our bigger fire hazards.
And your collaboration, with, like scientists and like architects and engineers, like what have been some like benefits and working with different disciplines, and also some challenges. And how does that inform like your future directions of working with urban planners to address, this trade-off?
Yeah, so I have been working interdisciplinary for a really long time. So I actually did my undergraduate in interdisciplinary sciences. And then at Michigan, I worked with Siobhan Harlow. I did the program that I can't remember what it was called, where it was bringing together people from different disciplines. And so, I feel like over the years, I've worked with a lot of people. I think the worst sort of collaboration that I had that made me feel really bad for the skills that I had was working with anthropologists. And we get along great now, but it was a real rough road because they did not value at all quantitative work. And they said, it's just numbers. You don't really know what's going on. It's just a total black box. And, I was really excited about learning qualitative work, but, I think you just have to, first of all, you have to have thick skin because not all researchers in another discipline will necessarily respect the skill set that you have. And you have to be open and empathetic and listen and learn. Do not be afraid to look ignorant. That's something I've really learned over the years is I will say, I don't know how you use that term in your discipline. Can you explain it to me? So just being very humble, sort of coming to the table and saying, this is what I do. How can I, contribute? I feel like I'm kind of a director in many ways that a lot of times because I kind of know a little about a number of disciplines at this point, I feel like I kind of know who can do what and put people together and kind of broker the relationships. But it's not easy and it takes a lot longer sometimes to do research, but I think it's worth it because it's fascinating to learn things from other disciplines. So I don't know if that really answered your question, but yeah.
One quick question. Could you say something about the discrete choice experiments you're doing? I was just curious.
Yeah, so this is a new area for me. So essentially what it does is, are you asking like what they are, or are you asking like what we're actually gonna ask?
Either.
More details?
What
Okay.
you're gonna ask. Yeah,
Okay.
just curious what you're focusing on.
Yeah, so we'll be focusing on sort of the ultimate question will be sort of barriers and challenges to park use, like preferences and prioritization, and like how do you decide when to use a park, what do you use it for, and sort of like trying to get people to give us a little bit more information on how they would prioritize different trade-offs. So that's the essential sort of, that's a bullshit, yeah.
Right. Well, thank you. This was
Great.
super interesting.